Type 2 diabetes diagnoses are dramatically rising in kids as young as 10. And we're joined now by pediatric endocrinologist Dr. Jeannie Trigestad. And doctor, what's the big reason that you see behind the increase?
Thank you so much for having me. Yes, we are seeing this really dramatic increase in our youth. Actually, from our most recent studies, the number of kids with type 2 diabetes is increasing by about 5% per year. And this has many reasons. Some of it is related to the fact that we also see obesity increasing. And obesity is increasing, again, because of our change in activity and the changes in our diet as well. And these all impact and play a role in the development of type 2 diabetes, as well as other factors like your family history. And if your mom had diabetes, for example, when she was pregnant.
And as we see these new issues arise and we see some of these changes in kids and in society here, we need new leads for answers here. And you're leading a new clinical trial for OU on this issue. Can you tell us a little bit about some of the things you're studying?
Absolutely. So we here in Oklahoma are part of 15 centers across the United States that are now involved in our study called Discovery. It's Discovery for the risk factors for diabetes in youth. So we're really trying to get out what exactly about kids predicts who's going to get diabetes and who doesn't. We're looking at kids that are kind of in their early preteen, teenage years before they develop diabetes, and then following them over about 2 to 4 years to look at who does develop diabetes and who doesn't. When we better understand who's going to develop diabetes, that's when we can really start looking at how do we prevent it.
And as you go through a study like this and you get people involved, what can they expect? I mean, it's one thing to say that we need people and we know folks want to help out the way they can, but how involved will this be for them? What do they need to know?
Absolutely. So one of the benefits here is we're going to be doing a lot of screening for type 2 diabetes. So if you have a child that you think is at risk, we will be continually screening them about every 6 months. And coming in and doing some blood testing as well as doing some questionnaires to learn, things about the environment, things that we think may be impacting who's going to get diabetes and who doesn't. In adults, when we think about pre-diabetes, it's a pretty good predictor that they will eventually develop type 2 diabetes. When we use the same criteria in youth, it's more like about 5% or so that develop it. So we really need to better understand what it is that predicts who's going to get diabetes and who doesn't.
Yeah, it's something that's going to be becoming a bigger issue as we continue to move forward if the trends stay the way they are. So we appreciate all the work that you're doing, Dr. Trigestad. Thank you for joining us here today.